traveling. If anyone is beyond the 12 weeks for whatever reason, including the failure of medication, abortion, they still have to travel. And I guess 4 years ago, we didn't see it coming that there would be a pandemic, and that travel would be curtailed. And I guess I'm on this side where I'm like, I'm very much pro-choice. But there was also the restrictions that we had to try to control the pandemic in terms of travel and mandatory health quarantine, the hotel quarantine. So we had, because of the pandemic, we had restrictions and considerations for people who are disabled. So we have people in the general population who are disabled and who were very much susceptible to the virus. And we had measures to try and keep the virus at bay. So we had the mandatory health quarantine, with which I agreed. I'm someone who's immunocompromised. I very much prefer to be alive. But we also have disabled people who have these very same conditions who may need an abortion. So they were forced to travel. So I think when we look at these, the problem wasn't the mandatory hotel quarantine, was the fucking travel. People shouldn't have to be traveling for abortions, And I guess this was a warning that we gave when we talked about people who are undocumented or with a precarious immigration status. Like, if you don't have a permission, you can't leave and come back. It's not easy to do that, and it puts a lot of pressure on people. Even if you are documented and you need a visa to go to the UK or to another EU country, like, that is a barrier. Again, the problem is, aside from borders, travel. And look, if we had looked at all of that right now, even Irish people, we have a massive delay in passports. So guess what? It's also affecting Irish people who have every right to travel. So I think, if we had acted on that, things would have been much better. And look, I guess when we're talking about, the policies to put in place for the needs for those that are most marginalised, something that I think a lot of us warned a few years back was, look, if abortions are going to work the same way a lot of healthcare works, you need a public services number. And I know I get very bureaucratic on this, but it's like, some undocumented people don't have a PPS number. And right now, the way the system is set up, you need that to access not just abortions, but you need that to access other types of reproductive care. So if you do decide to continue with a pregnancy, you need a PPSN to access health, maternity care. So even people who are not pro-choice should be fighting this. So I guess, and that was a barrier. It's a barrier for our siblings in the north who want to access abortion in the island of Ireland. But right now, again, we didn't foresee it, that there would be a 12-week delay to access, about 12-week delay to access PPSNs for anyone who's arriving in the country, documented or undocumented. So if someone comes here on a work permit, or is a student, or is, any other immigration status, they'd be waiting 12 weeks. And you know what? The 12 weeks, we have that time limit within the legislation. So it's like systems are pushing people to not access the care that they need. Right now, I think if people look, the Irish Refugee Council said that about 1,200 people have yet, who are seeking asylum, have yet to complete the initial application process, in that they get what it's called a temporary residence card, so a TRC. Without that TRC, you cannot get a public services number. So you have people for months in places that are not direct provision centres without a PPSN. So without a TRC, so they cannot get a PPSN. Without a PPSN, they cannot, again, access maternity care, medical card, and abortion. And also, without a PPSN, you cannot even get financial support from the Department of Social Protection. So if you needed to pay for that abortion within our medical system, you can't even get health. It's a financial support from the Department of Social Protection. So it's like, we need our own abortion support network here within Ireland for the people who don't have a public services number, because they cannot access the free, safe, and legal abortions. They're not effectively free for them. So, and then we can go on to geography and the need to travel, and people in rural Ireland, and disabled people, and people who experienced domestic violence, and people who live in poverty, and people in the asylum system. And some people are more than one of those things. So if we had just copped on and planned the services to meet the needs for those that, So that's my rant. Thank you. I'm going to leave now. I'm going to stay quiet.
No, that's not a rant. It's the elephant in the room. So thank you. I'm going to bring in Deborah now. Deborah, I think I apologize for who was waiting. I think I did forget to press a little button, but that's okay. And I'm bringing Deborah in now to our conversation. We're all talking about where we are 4 years later after Repeal the 8th. Deborah is an activist, a mental health advocate, a sanctuary runner, and also a single mom of 4. And she's here to tell us about how you feel where we're at 4 years later, Deborah.
I suppose I'm like Majo. I can't believe it's 4 years. It still feels like it was yesterday. Like people were on the street, campaigning and trying to canvass and get people to vote. I don't think much has changed. In terms, I'm just kind of going to look from the education part. So like a lot of women still don't even know what their choices are. There's just the shock and the confusion first when a woman gets pregnant and maybe there's complication or if it's unwanted or the process of actually getting pregnant itself, just the shock of it, but not having that education or awareness of the choice to make with that. And even now that there's the law that says in Ireland that making abortion legal, right? It's there's no education on the ground for anyone, for mothers, for young people, for for me, I 100% believe in education. Like if you inform people, then they can make right choices. And society is not even talking about it. The law is not saying, well, there's this the it was very loud before the amendment was made. There was a lot of noise, but after that, it's just been like, oh, is like, and I suppose, it's great that we're having this conversation 4 years later to say, it's 4 years. What has happened since 4 years? What has changed since 4 years? And so for my own, I think what I will continue to advocate for is give people choices, give them information, even with the travel bits that you're talking about, like people waiting for a lot of people don't even know that exists. They don't know that some people are kind of limited what to do, So part will be, let's put the word out there and say, this law exists, these are your options, these are your choices, and we don't really need. I think the system really needs to be in place within us. You can't educate me and say this is the right that you have, but I can't even assess that right. So yeah, a lot still needs to be done, really.
Yeah. Thank you, Deborah. Thank you. How about you, Sam?
Am I still here?
Yes, you are, Deborah. Don't worry. Sam's talking now. Yeah.
Hey, Joe, how you doing? Thanks for having me on. I guess Majo and Deborah have covered a lot of the problems that were almost foreseen with abortion provision when it finally came in. But I suppose what I'd like to talk about is the provision itself. Leaving aside the people who are left out, the laws that we have that were brought in the 2009 Termination of Pregnancy Act were hailed obviously by the people bringing them in as being allowing for freedom of choice, and were a huge step forward. And there was a lot of politicians sort of jumped on the bandwagon at the last minute and used it to blow their own trumpets. And they talk about the provisions for abortion, but really the provisions that we have are still very restrictive. I would more refer to them as restrictions rather than provisions. And the way in which their restrictions, sort of all the different aspects of that, feed into each other. For example, you have the 12-week limit. Now that a lot of sort of anti-choice or anti-abortion people call that very wide-ranging. And in fact, it's really quite restrictive. Apologies, because someone might not find out that they're pregnant for quite a number of weeks, and then they're coming up against this barrier of 12 weeks quite suddenly, and after 12 weeks, all of a sudden you're at a cutoff point. And the people that Majo referred to who might have a different immigration status, or they might be in a rural area, or they might be working class or young, and they may not be able to access abortion services within the couple of weeks that are left remaining to them under the 12-week provision. So that, and then there have been examples documented by the Abortion Rights Campaign where people have just had delays forced on them by circumstances, which means that they attempted to get their abortion within 12 weeks, and they were just restricted from doing so, and that 12 weeks then acted as a restriction. They come up against that barrier of 12 weeks, and all of a sudden they have to travel to England, or they have to order abortion pills illegally, like we were doing before the repeal of the Eighth Amendment. And then, sort of going hand in hand with that 12-week cutoff period, you have a 3-day waiting period, which the Abortion Rights Campaign described in its press release today as paternalistic, and it's telling people who need abortions you don't know your own mind. But it also acts as a restriction along with the 12 weeks, where it essentially cuts down the 12 weeks to 11 and a half weeks. And as I said earlier, those weeks go by very fast if someone's in a crisis pregnancy and they're not in one of the few areas where abortion is readily and easily accessible. Suddenly your 12 weeks become 11 and a half weeks, and then if you don't know you're pregnant for a while, then your 11 and a half weeks becomes, say, 7 and a half weeks. So I would call the provisions that we have, those are restrictions. It's abortion care for people who can afford it, which is what we had before the Eighth Amendment. It was abortion care for people who could afford to travel. Another major problem that was left in the legislation for the so-called provision of abortion is that abortion is still criminalised in Ireland. If you provide, if a doctor provides an abortion after that 12 weeks, that doctor then faces 14 years in jail, up to 14 years in jail, and that in turn goes hand in hand with some of the other restrictions. Again, that criminalization goes hand in hand with the 12-week period. You can have an abortion after 12 weeks in circumstances where your life is in danger, or your health is in danger, or in the case of fetal abnormality. However, the doctor who prescribes abortion in the case of fetal abnormality has to be able to prove conclusively they are certain that a baby with fetal abnormality would not have lived more than 28 days, or else they are criminalized by the laws we have and face 14 years in jail. So very few doctors are going to provide abortion in cases of fetal abnormality because of that risk of criminalization. So one of the largest groups of people still traveling for abortions are parents who suffer, tragic diagnosis of fetal abnormality. So we see again how the so-called provisions that we've been given restrict people in access to abortion. What that criminalization also does is it allows GPs who are anti-abortion to refuse to provide care, because they'll put their hands up and say, well, I'm not comfortable because of the criminalization. In any circumstances, they can say that. They can say, well, I refuse to provide abortion health care because of the criminalization. So this is another way in which people's options are restricted by the so-called provisions that we have. Now, when you look at how abortion is provided around the country. It was always the intention of the government that we would have that abortion would be provided by GPs and maternity hospitals. Now, Ireland has 19 maternity hospitals at the moment, and at the moment, 11 provide abortions. And it's intended that that'll be up to 13 or 14 by next year, which is progress. And we have to credit where it's due, however slow it is. But the thing is that not all of those maternity hospitals provide all abortion services. For example, I think Sligo was the latest to come on board providing services, but it doesn't provide surgical abortion. So again, if you're in the Sligo area, that's one more of your options gone. That's one more set of traveling you might have to do. That's one more week towards going up against that 12-week barrier. And then in terms of GPs who provide, there are over 4,000 GPs in Ireland. So the government that brought in the legislation had this vision of GPs being available everywhere around the country. But only around 400 GPs currently provide abortion services in Ireland, and they are centred predominantly around urban areas. There is actually a report in today's Irish Examiner that discusses which counties have and which counties don't have abortion services. So if you're in Dublin, or if you're in Cork, or if you're in Galway, you're grand. Whereas if you're, I think if you're further north, if you're in Sligo, and down here in Cork, we think that the Galway and Sligo are the same thing because they're in Connacht, but they're hundreds of miles apart. Asking someone to go from Sligo to Galway for abortion is an enormous act. So there's a very patchy GP coverage as provision of abortion. There's been next to no training for GPs who want to provide abortion. There's next to no funding for GPs who want to provide abortion. So the government has really let down GPs who want to provide. Now, Mike Thompson of START, Doctors Southern Task Force on Abortion and Termination Provision, told us at one of our seminars last year that a problem that some GPs run into is that they'll be part of a practice that's led by a senior GP who doesn't want to provide abortion in their GP services. So you have GPs who want to provide abortion but are being blocked from doing so. And again, that senior GP who doesn't want abortion on their practice might say that one of their concerns is the criminalisation issue. And then another thing that prevents doctors or GPs from providing is the lack of safe access zones. Now, safe access zones prevent intimidation of abortion service providers and users outside the premises. It was one of the things that was promised by the government when the Eighth Amendment was repealed, but it's not the case. And so anti-abortion activists can put pressure on GPs, particularly those who are susceptible about worries about criminalisation, to force them not to provide abortion. So that this is why we have a situation where 1 in 10 GPs approximately is providing abortion, and if you're not living in the right area, you have to travel just as you had to before the Eighth Amendment.
That's a lot of facts, isn't it, between Majo and Sam and even Deborah, just listening to these facts, sometimes it's like, how can we keep it on top of all the things that are failing us? And that's extremely hard. I think we all agree, is that we have to continuously advocate for choice, the education of why choice is important. And that in itself, saying that out loud, it in itself is like, oh my God, here we are. It's like we're back at the same place. It's back to square one. And so my question to you is, well, we'll go with Deborah. How do you think we can empower everyone, all genders, people from all backgrounds, to uplift that right to choice? What do you think you would be able to do, Deborah, within reason?
Yeah, within reason. I suppose first and first, like at home, the bias around that, the stigma around abortion and labeling and the faults that's or like it's your fault kind of thing, that you need to unlearn that. And I think at the core of it, the change has to start from the GP, because that's where the solution is. Like a woman can make that choice, and if there's no solution to the choice to match it, then nothing is done. So like as from the home and as a society, that labeling, we need to really, really unlearn that, and it should be support instead of judgment. And the system itself, like the system is, I know, and Sam was saying, give credit where credit is due. I think there's a lot of unresolved trauma that is happening among women. So the system itself needs to really, really significantly change, and support needs to, like the GP needs to be able to exercise their rights, to because health is important, right? It's important to have health. And if you're having, maybe, I don't want to say abortion is the same thing as maybe having a cold or a cough, but you can go to the GP and trust that you get solution. So it should be the same thing. Like, for you to want to have an abortion is not something that you want. It's a woman's choice. And if you go to the GP, you should be able to have the solution. But if there's all the system in place stopping that, that's really, and I think we still need to keep talking about it and raising awareness. And I suppose the more people are talking about it, then things can really change, and not just us, just waiting, not say anything until it happens to us or is at your doorstep. So we just need to keep educating and informing and say, there's this law here, how can we make this law better? And effect, if just the law the way it is, if we follow it through, it's almost kind of effective, but it's not, because there's a lot of barriers to holding it.
That itself is loaded. Thank you, Deborah. How about you, Majo?
I think listening is a good idea, in a way that so many of the issues that are being brought up again and again have already been, talked about for years. So, and maybe that's for us pro-choice people, because there are groups that were left behind, and many, including migrant groups, have been saying, you're going to leave us behind, and they were. We were. So look, I think listening is good, and because a lot of these things have been said. But one thing I'm a big fan of is just sometimes bringing the concept and the problem to the ground, and give an example. So I would always be like, okay, look, when we're talking to people about what these very real issues are, let's think about someone, let's say a woman in, and it can be in Cork, we could say, look, maybe she's in Alihees and she's already a mother, because I think there are many stereotypes in terms of, like, look, the people who get abortions are people who don't have any children, but let's say she's a mother, let's say she's a single mother. So when you don't have local abortion, when you don't have maybe telemedicine options to make sure that she can get access to the healthcare that she needs, when you put it too far away from her, what are the barriers? Childcare. What's she going to do about childcare? Who is she going to leave the children to? We still have stigma. What type, is she working? She's going to have to take annual leave, not to go once, but twice, because the doctor has to make sure that you, based on the law, that you've made your right mind, because, you're a feeble person. So, it's not only once, it's twice. How do you get from Alihees to a close provider who is not an objection? People say conscientious objection, but I say conscientious obstruction. So how do you get yourself to someone who's not an obstructionist? Look, maybe she might have to travel to Bantry or to Cork City even. How do you get there? How much does it cost? How many times a day do you have a bus that comes maybe from Castletownbere to Cork City? How many hours do you have to spend on the bus? How much is that? and you're already losing wages. What if she is disabled? What if she, for example, has a weak immune system, so traveling on public transport is a bit risky, when we have a pandemic? What if she's a wheelchair user and some of the buses in rural areas are not accessible? So I always say, look, we need to put things into context. And when people think about these examples, or maybe she wasn't single, maybe she's with a partner who is abusive, how does she explain having to get away a couple of times because she has to go and do that consultation twice? So I think very much bringing things to the ground, into and we don't have to share personal stories, but let's think about someone who meets these characteristics. Let's think about an asylum seeker who's maybe in Donegal, because the quickest way to come from Donegal to, I think, to an abortion provider, or maybe if you have to come to Dublin, I think you have to cross the border, and technically they're not allowed to. They're not meant to be leaving the country. Even if it's just in Northern Ireland, it's still technically leave the country. What if someone is undocumented? So I think when we're thinking about these things, it's a good idea to talk about examples and what would you do? And I think that's possibly a powerful way to communicate, because people think about concepts, but these concepts apply to real people. And yes, the combination of things, it's not just a person. It's a person who might be in a rural area, who might be disabled, who might be poor, who might have children already, who might be a single parent, or who is in an abusive relationship. And sometimes you could be most of those things together. So we have intersections of oppression, so we need to think about those things as well. So yeah, I think an invitation to think about those examples is perhaps a good way to communicate about that.
So far we've got unpacking bias and listening, which are extremely interdependent. Okay, Sam, what idea would you have to empower people?
I think they've mostly been covered already. Obviously, education is the number one way of informing people that abortion is normal healthcare, and if there were these types of restrictions on any other kind of healthcare, people would be gobsmacked. They'd just be bamboozled. That for example, if Deborah mentioned having a cold. If, for example, if you had a cold and the GP, you had to go to your GP and tell them that you had a cold, and then they said, "Well, come back three days later, and we'll see if you still have a cold, and then you can have the medication." People would just not stand for it. And then I think the other point that Majo raises, people need to realize that somebody they know has had an abortion. And if you don't know somebody who's had an abortion, it's because they haven't told you that they've had an abortion. And the reason that they haven't done that is because the abortion is still stigmatized, which brings us circles us around to education. And you will never have completely accessible healthcare for something that is stigmatized, because there'll always be someone who says, "Well, no, that's wrong. You can't do that. You can't have that." And that education process needs to begin not amongst adults, but among young people. Abortion should be part of the conversation about sex education. Now, sex education is sometimes a hot button topic for conservative people, and to that you have to say, well, there's sex education that is appropriate to all ages. You don't tell you tell 6-year-olds where babies come from, but you don't tell 6-year-olds about other aspects of sex education, because their tiny little minds can't help it. I can't handle it. But at some point along the spectrum, there is a point where it is appropriate to tell children about both contraception and about abortion, because
and
for
consent.
me,
Consent. I think consent. We can start talking about consent from the get-go, from the day they're born.
Yeah, because bodily autonomy is part of consent, and bodily autonomy is part of abortion provision. So that's where it is for me. It's about progressive sex education in our schools, and that was again something that was promised by the government when Repeal the 8th happened, and along with free contraception. And where are we on either? Nowhere.
Yeah, there's not
free
enough.
contraception only for young women because they're the only ones who you're just like, oh my
Yeah,
God.
it is.
Yeah.
It is.
Can't even.
It's a lot, isn't it? And we were running out of time. But what I do want everybody today and every day who is working in this space, all of you, to take the time to rest, to take the time to connect with each other, and yeah, there is things to be hopeful for. This is not an easy road. We have come very far, but we have so much farther to go, and for that we're going to need all the energy that is required, and we cannot be. And I think simple steps every day will, yield greater results, and that's why the education, listening, and understanding context, as you all have said, are crucial for all of us in our everyday lives to change that narrative, and hope that 4 years later we would be having a much different conversation. So thank you so much, all of you, for making the time. And I know you all have an intense day today, and so please do take care. Okay, cheers. Thank you.
Thank you.
Thank you.
Thank you.
Hey.